Hi, Dr. Rakhe.
Hi, Dr. Mahek.
I'm Dr. Gulhima.
Gulhima. Okay,
Yeah,
okay. Sorry. So Mahek is the
Mehek
Mahekta is
and
the surname.
Mehek is actually my daughter who's also in her final year of MBBS. So,
Wow, wonderful. You
yes.
don't look like you have a daughter who's in MBBS.
Thank you. Thank you so much. And thank you for joining me live this evening from Delhi, India. And it's such an honor to have a pediatrician on board. And who better could tell us about the nuances of breastfeeding today? And we have Dr. RakheeYadav from Malaysia, who's a consultant pediatrician, and she's also an early nutrition specialist. So, Dr. Rakhee, could you tell us something about yourself before we dive into the multiple benefits of breastfeeding as we are going through the breastfeeding week from the 1st to the 7th of August?
Definitely. Thank you so much for the invite, first of all. It's an honor to be here as well. I love, I have family in India, so getting an invite for someone from Delhi is close to the heart. So
Thank
I'm Dr. RakheeYadav, everybody. I'm a consultant pediatrician from Malaysia. I was born and bred in Malaysia. And I've been working as a doctor for almost 20 years now. I have a postgraduate diploma in pediatric nutrition from Boston University. I also have graduated as an early nutrition specialist from the University of Munich in Germany just a couple of years ago. And my special interest is pediatric nutrition, childhood immunizations, and I've recently become a science advocate for COVID-19 and its vaccines. So thank you so much for the invite.
Thank you, Dr. Rakhe. And without much ado, I think let's begin the session on breastfeeding. And as I said, what better time to have a live session on this topic because, as you know, we are celebrating the breastfeeding week from the 1st to 7th to the of August, and it's celebrated every year in over 120 countries. And this year's theme is protect breastfeeding, a shared responsibility. And Dr. Rakhe, please tell us how important is it to actually breastfeed a child? Before we dive into the many benefits, multiple benefits, do tell us as a pediatrician and otherwise or a mother of 4 children, how important is it to breastfeed?
Absolutely, absolutely. So WHO, the World Health Organization, actually recommends breastfeeding for exclusively for the first 6 months of life and subsequently up to 2 years of age. I know many women out there are going like, oh, first 6 months, that's very difficult. 2 years, oh my God, that's difficult. But there's a reason why WHO came up with all these numbers, and I'll dive into that in a little bit. But there's so many benefits. And the first thing is breast milk is a living substance. A lot of us don't realize that. I mean, women produce this, right? So it's something that's natural. It's an amazing bonding from a mother to child. And yes, I have 4 children, and I've breastfed each one of them at various levels, various months, for various differences. And I've gone through every complication there is with regards to breastfeeding. So I can speak on a personal basis as well as on a pediatric aspect of it. So yeah,
So
that's a
thank
little
you
bit of
so
introduction
much.
with regards to breastfeeding.
That's been a journey, and that's really nice of you to have said so. A point to put across to our viewers this evening is that no matter how busy you are with work or whether you're a professional woman or not, I think it's so important to dedicate those first 6 months to the child and breastfeed the child because, as we all know, that the American Academy of Dermatology, the WHO, everybody, all the major bodies recommend that breastfeed should be the only nutrition for a child in the first 6 months of age. They don't even need water. So I think with that little introduction, Dr. Rakhe, do tell us how important it is to start breastfeeding in the first hour of birth. Do you think it is important to start feeding the baby colostrum in the first hour of birth? And why? If so, why?
Well, I'm going to start off by saying colostrum is golden liquid. It's literally golden liquid coming from your body, and it's the best thing that you can give to your newborn baby. I know a lot of mothers are like, but there's so little bit of colostrum that I'm producing. There's only a few drops that's coming out. But mind you, the size of your baby's stomach is actually really, really small. So all you need is even a few drops to keep your newborn baby satisfied. So it's very important. Studies have shown multiple times that in the first hour of life, skin to skin touch with your baby, as well as breastfeeding, early breastfeeding introduction, helps to adjust the microbiome. We'll go into this in a little bit. The microbiota, your gut microbiota in your body, and as well as produce so many beneficial effects to the mother's body to be able to recognize that, yes, she's just delivered a baby. Let's start the breastfeeding journey and let's get this going with your newborn child. So it's very important in the first 6 hours of life, first 12 hours of life. In fact, immediately, some women after delivery via cesarean or vaginal delivery, the baby is immediately put on the chest. And I speak this from experience as well. So I delivered in a same hospital for all four of my babies, and all four of my babies were immediately kept on my chest while they were doing the rest of it, while they were settling the placenta and everything. The baby was immediately on the chest. So that's just skin to skin. And
All right.
immediately you start breastfeeding. So it's very important.
So it is important. And I do believe that you do prevent the sudden infant deaths, and the infant mortality also goes down by about 19.1% if the babies are breastfed in the early hours post delivery. So that is absolutely important. And you brought out a very important point, Dr. Rakhe, when you said that women are often worried that, the breast milk expression is not enough. They are not able to produce enough breast milk. I think that's more of a myth. Don't you agree that as the baby grows old and the baby needs more requirement of breast milk, you automatically tend to secrete more, rather than them thinking that, they are underproducing the milk and they're always worried about what is to be done. So what is your take on this? Unless, of course, the mother is suffering from an illness where she cannot, produce the breast milk. So do you feel it's a myth, or there's truth to this, that there isn't enough, people are scared about not producing enough milk?
There's definitely some truth in that. I know many of my colleagues, especially professional mothers, working mothers, who feel, or even at home mothers, who feel that they're not producing enough. And that's one of the reasons why they actually stop producing milk, because they feel that it's not enough. My baby is still crying. I'm not producing enough. But you see, breastfeeding is a lot of a mental thing. So the more you tell yourself it's not enough, the less milk is going to be produced. So it's definitely an issue among a lot of new moms, especially if you're a second, third time mom. I think after a while you realize, now my milk's going to come, my letdown's going to come. But in the first instances, if it's a newborn, new mom, you're a new mother as well, you definitely have some issues with regards to supply. Can I just go back a little bit with regards to the benefits of breastfeeding? So besides the first few hours of life, there's actually so much more benefit, not only to the baby, but to the mother as well. So you mentioned SIDS, it reduces sudden infant death, but it has been shown that even breastfeeding for 2 months, just 2 months of breastfeeding can actually reduce the risk of allergy,
Yeah.
right? I'm pretty sure we'll go into a lot of this in a bit. Breastfeeding a child for 6 months reduces your child's likelihood of developing childhood leukemia by 19%. And for me, anything above 0 is actually a huge number.
Absolutely.
So the other thing is breastfeeding for up to a year produces a lifelong reduction of your baby developing non-communicable diseases such as diabetes and heart disease. So these are all benefits to the baby besides the sudden infant death. And one of the other things that we rarely talk about is actually oral hygiene. It reduces tooth decay and encourages proper oral development. Now
Yeah.
we move on to the mother. So besides the effect of, I think a lot of mothers, they want to know whether they can lose weight with breastfeeding. Yes, breastfeeding actually allows you to lose up to 300 to 500 calories per day if you're breastfeeding. So it helps with postpartum weight loss in majority of women, not all. It also helps with uterine contraction in the first few weeks of delivery, so that you bleed less, you don't have a lot of stagnant uterus movement, and also it helps you recover very much faster after your delivery. So a lot of moms in the initial first few weeks will say, oh, my breast hurts, my stomach hurts. It's because your uterus is contracting each time your baby suckles, and that's just a normal reflex a mother will have. So all this together with added benefits of in the long run, reducing the rate of mothers developing breast cancer, uterine cancer, ovarian cancer, just by breastfeeding. So a simple thing as breastfeeding your baby reduces all these other diseases for a mother, which I find so much more beneficial. The other thing is something interesting. A study recently showed about postpartum depression. So we are seeing mental health issues on the rise, in my country at least, but I'm pretty sure it's worldwide. So it has been shown that when you breastfeed your baby, it releases what we call a love hormone, or what we call oxytocin. So when that happens, you tend to feel happier, you tend to love your baby more, you tend to feel much more satisfied, and reduces your postpartum depression, at least in the first 4 months. So
And
these are just a couple of benefits.
oxytocin also helps to involute the uterus more. So that will also help, yes. So that also,
Yeah.
yes, Dr. Rakhee, you've listed out a plethora of absolute benefits, not just for the infant, but for the mother. And just to add to this, it improves the IQ of the child also. People with
Oh, yes, yes.
fed are sharper, they have lesser life stresses, they are able to, they have lesser adjustment problems later on in life. And I think the benefits are innumerable. uh, uh, no doubt about it. There have been multiple randomized control studies and systemic reviews on this. Now, Dr. Rakhee, we all
I think
know
we could
that
spend the whole half an hour talking about the benefits of breastfeeding, but just naming these two is good
yes,
enough for you to,
yes.
you can always build up the rest of it.
And of course,
Yeah. So we're going to move.
not forgetting the amount of money it's saving you, because you're not using infant formula, you're breastfeeding your baby, which is actually the best nutrition for your child in the first 6 months. And the WHO says you can continue feeding even beyond a year, or even up to two, till the time the baby and the mother decide to call it quits. So that's what the WHO says. Of course, after 6 months, you do have to supplement with other things. And just for our listeners, the breast milk is a little deficient in vitamin D unless the mother is taking it in too much excess, which is not justified. So vitamin D probably has to be supplemented. Otherwise, it is a wholesome food for the child, wholesome nutrition. Not even water needs to be given in the first 6 months. So that's how, important it is as a wholesome food for the baby. Now, the other
Yes.
thing that you brought out about was the gut microbiota. And we all know that before that also, it is a lot of immunological benefits that the breast milk gives the babies. So we all know that there are the passive transfer of antibodies from the mother to the child, which do help the baby. And since the baby's immune system is immature, you tend to, obviously, it is good that the maternal antibodies are being passed on to the baby, and the baby can fight the infections. So the breast milk has antiviral properties, antibacterial properties, and also develops the baby's innate immunity. Would you like to throw some light on the uh, immunogenesis part of breast milk?
So I'm going to keep it very simple so that our viewers will be able to understand. So many studies have actually shown that biodiversity, that means various organisms in your gut, plays a huge role in our immune system, right? But this is complex, and it's also multifactorial. Whether you deliver vaginally, whether you deliver by cesarean, whether there was skin to skin, there are many factors behind it. And we've noticed that breastfeeding babies have predominantly higher levels of bifidobacterium as well as lactobacillus. So these are two fancy names for just two very, very good bacteria that help in general with a few other chemicals in the body to eventually reduce allergies, aspic illnesses like asthma, and many other forms of diseases by just adjusting the microbiome in your gut. So, and it's also been shown that if there is some sort of microbiotic dysbiosis, so meaning the baby was ill, maybe the baby required certain antibiotics in the first few months of life, if there were other issues, that can adjust the microbiome. And in the first 100 days of life, it actually shows there's a higher risk of the child developing asthma. So there's so much more development. There's so many more trials that are ongoing with regard to all of this, and we know that there's so much more benefit that comes out of it. But just to put it out there, that microbiome in basically just good bacteria in your gut plays a huge role to breastfeeding babies,
Yeah.
which will be different to formula fed babies.
Yes, absolutely. And see, the bifidobacterium that you mentioned about is basically a prebiotic for the good gut bacteria. So, to put it simply, it's the good gut bacteria that help a lot. And with the IgA antibodies that are being transferred, they line the digestive system and the respiratory tract and prevent your baby from early onset infections, especially your common cough, cold, diarrhea. All of these simple infections can be really put at bay if you are breastfeeding your child and you start early on. So I think among the multiple benefits of a wholesome nutrition, the immunogenicity and the immunological what shall I, protection of the breast milk part is, I think, has a very, very important role to play. Now, Dr. Rakhi, there are some mothers who are unable to breastfeed their children due to whatever the reason may be. Do you think infant formula milk is anywhere at par with breast milk?
Okay, so it's a very tricky question, very controversial question, because we do know that there are a few contraindications to breastfeeding, and that would be, of course, mothers who are HIV positive, mothers who have active tuberculosis or untreated tuberculosis, as well as mothers who have cancer undergoing active chemotherapy. So certain chemotherapy agents don't allow you to breastfeed your child. So these are just a few contraindications, and let me say that again, there are very, very few contraindications. But we also have a few mothers who can't breastfeed for whatever, besides medical reasons. Maybe they are not the biological mother, maybe they adopted the mother, or they have a premature baby in NICU where they can't produce enough milk and the baby's not feeding well. So there are just a couple of other instances where mothers can't directly feed the baby. So these are just a few reasons why a mother can't breastfeed the baby.
So, do you think the infant formula is as good as breast milk?
I'm gonna say certain ones, nothing is as good as breast milk. Breast milk is still number one. In fact, in 1980, WHO actually said that the first alternative to breastfeeding is actually donated breast milk. So if you can't get breast milk from your biological mother, donated breast milk
Yes.
will be the first alternative, followed by formula milk and whichever formula milk that's suitable to your child. So it's still the first choice for all mothers. There may be a lot of infant formulas out there that will market, or just growing up formula that will market that these are almost mimicking breast milk, they're almost similar to breast milk. But the key point is it's almost similar.
I
Nothing
think
is as good as breast.
Yeah, I think it's the oligosaccharide component, the human oligosaccharides, which are a problem to actually recreate synthetically or to incorporate in formula milk, because the complexity of those oligosaccharides is so much, and human breast milk
Yes.
contains a lot of oligosaccharides, and that's basically the main component of breast milk that gives the nutrition, the prebiotic effect, etc. So you're right. If women cannot breastfeed, then breast milk banks are there, and express breast milk from other donors are a good option. Before I move on to another question related to that, we've got a question from one of the viewers. He's Broken Soul Boy, who's asking, breastfeeding, does it increase the size of the breast?
Well, to say that it increases the size of the breast is a little bit not really, but when you have an engorged breast, of course, the breast size will increase, but subsequently it goes back to the normal size. So if you're saying if you breastfeed a baby, your eventual breast size is going to move from a cup A to cup C, that's not going to happen. The only thing is during that breastfeeding, while a mother is lactating, the breast size will increase when it's engorged and subsequently decrease back again when your child feeds or when you pumped out your milk. So the size changes. And sometimes you might see one breast that's bigger than the other. It's because one is more engorged than the other. You fed one side more than the other. So in general, no, it does not increase the breast size. In fact, I know many women who, after they've completed their breastfeeding journey, the breasts are absolutely the same size again. In fact, some are actually smaller. So, because they go back to their normal sizes once again.
Yes.
There are some women out there who say that it sags a little bit, but that goes with even normal aging, because you have certain muscles or ligaments that actually hold up the breast tissue, and when it engorges, these ligaments tighten up and get looser a little bit, and it contracts again, they get looser a bit, contract again. So that's why some women have a little bit more tight breasts than after breastfeeding, but not usually a problem.
Your voice is echoing a little bit. Could you hold your mic up a little to your mouth? It's echoing a little bit.
Oh,
Yeah.
sorry.
No, now
Is
it's
that better?
yes, yes, it's fine now.
Okay.
So that was absolutely
Sorry.
right. So the lactating breast is definitely larger in size because you are producing more than gorge, but it involutes to its original size or maybe a size more or less. But there's no such known thing like the breast size is going to increase if you breastfeed your baby. And so much so for the figure as well of women, because as you said, you're losing so many calories while you're breastfeeding that it's actually really a good thing to lose weight. And that brings us to another point, that breast milk actually prevents obesity in not just the child but also helps to involute the mother and bring back the body weight of the mother as well, because
Yes.
you secrete hormones, you have a leptin inside, so the babies are their appetite and the fat storage was all related to the hormones there. And so the babies at least are protected from being overweight, something that we are so concerned about, metabolic syndrome in today's scenario. And it does help with the mother's diabetes. That metabolic profile of the mother also has been shown to be well within range if they are breastfeeding. So apart from just the looks, etc., of the breast or the figure or whatever, nothing happens to them. But I think the internal benefits are many, many more and more important. So now coming,
Absolutely.
yeah, you mentioned that you can use expressed human breast milk from donors. How sterile is this milk? How do you store it? Is there any particular precaution you need to take to store the milk, or how do these breast milk banks work? We'll just talk
Okay,
briefly.
Ken, I'm going to start off by telling a little bit about the history of donated breast milk. So back in the 11th century, this is long, long time ago, breastfeeding was deemed indecent. So the royals and the aristocrats and the rich people used to get wet nurses to breastfeed their children. But after a while, this sort of died down because they realized that hygiene is an issue, and all these women, you don't know what's happening with these women, and how safe is it to let your child feed from another woman. So then that's when in I think early 1900s, 1909 in Vienna, the first human breast milk bank was formed. And the purpose of this bank is basically so that there is a place where you can actually get these milk, collect this milk from the women, screen the milk, so screening of the women to make sure that they're free of diseases and and are safe to actually donate the milk, and they process. So process meaning pasteurization, storing, heating up in various ways. So different banks have different methods of sterilizing the milk and storing the milk for whatever purposes. Most banks store the milk for 6 to 8 months, but it also depends on the method of storage. And finally, the human milk bank actually helps to dispense the milk. So to mothers who can't feed, it's not available in my country, but in many countries all around the world, North, South America, India, Singapore, Australia, Europe, there are many places that have human milk banks. And basically, they just connect with the women who can't breast milk, and they either purchase the milk, or there's various methods of them getting these safe, already been screened milk. So the only issue now is cost, availability of the milk. And of course, some mothers are concerned about the safety. Who are these women who are donating? And then finally, in my country, there's religious reasons behind not having a blood bank, human milk bank. So these are just a couple of things to throw out there. The reason why we have these milk banks, and yeah.
All right. So that was an interesting information you shared with us. And now coming to the pandemic, Dr. Rakhe, what is the general recommendation of breastfeeding if a mother has the COVID-19 infection? Do you think breastfeeding, not do you think, what are the recommendations for breastfeeding? If the
Yeah,
mother,
it's currently actually, yeah, absolutely. So if a mother is COVID-19 positive, we actually recommend breastfeeding because breastfeeding has been shown to have some antibodies. I'm not saying that this is proven to a major extent and that antibodies may help protect the baby fully, but there is some transfer of antibodies to the baby via breastfeeding. And we actually recommend breastfeeding the baby provided the mother who's infected She just practices the usual SOPs, the public health measures, wearing her mask, maintaining hygiene, the usual methods, and maybe not keeping the baby close to her at a constant, only during feeding times the baby comes to her and then the baby goes off. But we recommend to continue breastfeeding and there's no stop in that. However, there are many hospitals that are a little bit, they're erring on the side of caution where they don't want the baby to risk getting infected. So they don't allow breastfeeding directly. They allow the mother to pump and give the milk. So it really depends on center to center basis, but the regular, the over the across the board recommendation is to continue breastfeeding even if you are COVID-19 positive, provided you are healthy enough to breastfeed. Of course, if the mother is ill, she's unable to even sit up, or she's intubated, she has a ventilator on her, then of course we won't recommend. But in those instances, there are cases where the nurses actually help to pump, especially the colostrum, the golden liquid part, and give to the baby. So general recommendation is to continue breastfeeding in a safe environment, practicing the public health measures in place.
So that's, I think, something that we needed to talk of during the pandemic. And moving on now to the last part of our discussion, Dr. Rakhee, how can we finish the discussion without talking of the benefits of breastfeeding in dermatology? So there are so many conditions like atopic dermatitis, other eczemas, infections, which even acne, psoriasis, that are related to the gut microbiome. What is your take? You would be seeing some pediatric dermatology cases. What is your verdict on propagating the importance of breastfeeding to prevent a long-term prevention of eczemas and not infections. Infections would be short-term, but eczemas and certain immunomodulatory conditions later on in life?
So we have studies that have actually shown that when a baby's gut is predominantly filled with, remember the two I mentioned earlier, lactobacillus and bifidobacterium. So there is certain studies that show that if a baby has E. coli, predominantly E. coli in their gut, it actually predisposes them to getting eczema. So there are a few instances where if they have certain funguses, they are more likely to get atopic illnesses like atopic dermatitis and things like that. And those who have Staph aureus, Clostridium, as well as bacteroides, they have higher chances of them developing some form of allergy in the early life, and even up to 4 to 5 years of age. So this is something that's important because we now know that the gut microbiota is associated with your immune system. And if you have good bacteria in the early periods of your life, eventually you have better skin, you have less chances of you developing respiratory illnesses. And we know that these are one of the reasons why most kids come and see a doctor in the first few years of life is if they're having a cough, they're having a cold, they're having a rash. So most of us pediatricians see usually kids in the first few years of life, besides for their regular vaccines, it's because of these. And we now know that this is strongly associated with various microbiota, and we know that breastfeeding confers the better bacteria to be predominantly in your body. There will be, like I said, an array of organisms, but breastfeeding makes sure that the good fillers, the good organisms are there compared to formula fed babies, which have a higher levels of those that are not so great, like the ones that I've just mentioned, E. coli and things like that.
So I
I hope
think
I said that.
innumerable studies and literature to prove that beyond any kind of doubt that there is a positive association of breastfeeding with the alleviation of atopic dermatitis and atopic eczema even later on in life. And we know how difficult a condition it is for children who suffer from atopic dermatitis, not just for them but also for their treating doctor and the parents. It's a very agonizing condition. So I think one of the one of the strongest associations of breast milk has been with atopic eczema and of course other infections which are kept at bay because of the lysozymes, the neutrophils, the immunoglobulins that are transferred from the mother, other than the good bacteria, from the mother to the baby. So that kind of sums it up in as far as the dermatological part is concerned. But there are certain interesting things. In fact, even studies that have been published in good journals, international journals, which say that the topical use of breast milk also helps. So, have you ever recommended any patient to topically use breast milk for cracked lips, chapped lips, or cracked nipples, or preventing an ear infection in a child, or preventing the blockage of the tear duct or anything of that sort? Because yes, from the dermatology point of view, I can speak that interestingly, there was a study in the Journal of Pediatric Dermatology in 2013 which said that diaper rash can be treated with topical application of breast milk, and it was found to be as efficacious as a 1% hydrocortisone cream. So that really intrigued me, and when I read further, I also read another paper which said that was published in the International Journal of Dermatology, which said that later on they found that it was topically applied breast milk was as useful as 1% hydrocortisone cream for atopic dermatitis. So that was very interesting for me. As a pediatrician, have you ever prescribed topical application of breast milk?
Yes, definitely, especially in the first two instances where you mentioned cracked nipples, cracked lips. Definitely. Even in certain diaper rashes as well. I have not prescribed breast milk. This is just personally for tear duct or for ears, but definitely on the skin most of the time I tell them, and it usually works. Even speaking on a personal basis, I've tried multiple nipple creams and things like that. Nothing really worked except for my own breast milk. So I can speak from experience, as well as when I recommend it to patients and they immediately referred back to me and they're like, Doctor, Dr. Rakhee, none of the creams worked. But when I put my own breast milk, it worked. So I'm just going to continue with that. I'm like, yeah, it's definitely, like you said, it's cost effective. You don't have to buy it. There's no equipment needed. You just pump it and you put it. So definitely it's of clinical use. And it's interesting to note that there's also papers that, back up on a science, on a evidence based as well. So
Yes.
yeah.
That's interesting that you've got a first-hand experience with this. And as a dermatologist, I've never recommended this. So after reading this, I think I should go back and at least for lactating mothers, try this out. They've also used it for cradle cap, that's seborrheic dermatitis of the neonates. And they've also used it for certain other conditions. And I found it extremely interesting because, I mean, what better, as you said, than breast milk, it's your own homegrown thing, and it doesn't
Yeah.
cost a. And as you said, it's backed by evidence, so we can. It was also tried in neonatal acne, spreading it on the
Oh,
baby.
yeah.
Yes, it was found helpful because again, acne is related a lot to the gut microbiome, and somewhere there could be a connection, and that's how it probably worked. Plus, the anti-inflammatory properties of the neutrophils in the breast milk, etc., could probably work on the the conditions we're talking about. So, Dr. Rakhee, with that, I think we'll end the session. And thank you so much for your insights and beautiful, views on everything. It was really educative for everybody. I'm sure people who go back and watch this IGTV video on our Instagram post are going to be really delighted to hear all the information that has been shared with them. And thank you so much for joining me this evening, all the way from Malaysia. It was wonderful having you. And here's to many more sessions in the future. So I think, would you like to sum it up for our viewers today, and one tip that you would like to give them before we close the session?
Absolutely. Thank you so much for having me, first of all. And I just like to tell every woman out there who are maybe starting their journey or maybe going into the journey that breastfeeding is a journey, right? You may have ups and downs throughout the journey. You may have some complications. You may have moments where you find that this is the most bond, that's the most you've ever bonded with your newborn, but go through it like a journey and keep at it. You just keep breastfeeding as much as you can and always believe in yourself. Keep telling yourself it's all mind over matter. Keep telling yourself that you have enough milk and your baby will automatically be fed the right way, with the right amount, with the perfect quality of golden liquid, we call it. So thank you so much, Doctor, for inviting me. And it was absolutely a pleasure, and wouldn't mind doing this again in the future as well.
Thank you. My pleasure, Dr. Rakhee, and thank you once again. Bye-bye. Have a nice evening ahead.
Bye bye.